Tvisha Parikh. I'm an exercise and sports medicine physician. I am grateful to be speaking here today on and sharing my knowledge on what gives better results, a morning walk versus an evening walk, especially in the diabetic population. So, the basis for this talk one is that the muscle is the largest insulin sensitive organ, and diabetes being predominantly a insulin resistant state. When muscles are exercised, the insulin sensitivity increases, and that's how we see the benefits in diabetes. Now, the minor point over here is which whether morning versus evening exercise produces better results with this sensitivity. So the base of this is that all the body cells have an internal circadian clock which is affected by light. In addition to light, though, exercise and food are very other potent stimulants for this clock. And exercise is markedly a big modulator of the glucose homeostasis in this circadian clock. So the glucose homeostasis is affected by the various hormones, substrate oxidation, insulin sensitivity, and all of these undergo diurnal variations. So, what are the ways in which fluctuations happen? The main hormone, that is insulin, has a higher peak in the morning, lower in the evening, and insulin sensitivity is also higher in the morning than in the evening. As against that, though, the hormone, that is catecholamine, which we know produces higher levels of glucose, is also high in the morning and lower in the evening. However, catecholamine has a dual role wherein, because of its effect on the fat metabolism also, it is dual whether it a higher glucose level that it produces in the evening, in the mornings, is going to be hampering the sugar levels, or the increased fat metabolism which it produces because of its higher levels is beneficial for the overall insulin resistant state in an obese diabetic. Another factor which affects is the oxidative capacity of the mitochondria, which is at its peak in the evening. So, a hypothesis for that is that when the oxidative capacity of the cells is higher, and if a person is exercising at that time, he or she can actually exercise much better, especially in this population, which tends to be slightly deconditioned exercise wise. So they could exercise better in the evening and they can produce better results and better glucose homeostasis. Thus, overall, if you go to look at the biochemistry, insulin sensitivity is higher in the morning, but oxidative capacity is higher in the evening. And there is a kind of a dual things that the way the things play out. When scientists have looked at studies in mice and in human population, and they've looked at transcriptional analysis in mice, they found that yes, the glucose clearance was definitely better in the mornings than in the evenings. However, when good quality studies have been done in humans, randomized controlled trials, looking at diabetic populations as well, they have not found a marked difference between AM versus PM exercises. Another big factor which plays a role with how the glucose levels change in the body is the substrate availability, that is the food availability. So whether an exercise is done pre or post eating also makes a huge difference to the glucose levels. Hence, in view of the fact that there are multiple variables which affect the person, it is not very easy to always delineate. So I think as a closing remark, the best advice to give a patient would be to, on my behalf, would be that pick a time of the day when you think you can exercise on a daily basis regularly, because it has been shown that adherence to the exercise is to an exercise program is the most important thing, rather than having breaks in the exercise program. An alternative suggestion would be, if the person has the availability of time, to split the exercise into two schedules, that is a morning as well as an evening schedule, reaping the benefits of the various hormonal changes which happen. And because exercise has this increased metabolic rate action, which goes on for about 12 to in fact 24, 48 hours, with two batches of exercise happening, this spillover effect can continue, achieving better glucose homeostasis for a more longer period of the day. That's, I think, would be my closing remark, saying that allow the patient to choose the time of the day when he or she can exercise most regularly by being most compliant. I would thank RSSDI for giving this opportunity to share my views, for picking such a brilliant topic, because this is something that patients regularly ask because they want these variables known. But the message I would like to convey is that let's get all of our patients to exercise first and then bother less about these minor things, because they produce only minor changes. But long term exercise is what is going to produce the best benefit. Thank you to all the organizers, RSSDI. Pleasure to be here once again. Thank you.